Committee will come to order. Clerk, set the roll call.
Mr. Chair, you have a quorum.
Okay, thank you. All right, first we're going to hear from the Energy Subcommittee. And on these bills where they've come from the subcommittee, there won't be any audience or outside participation. Just the sponsor of the bill, that's it. Okay, Senator Spruill, you're up.
Thank you, Mr. Chairman. Mr. Chairman, the first four bills, the bills have been worked out with all sides. We asked the question, were all sides present? Have they worked it out? And they all were happy and they've been worked out on all four bills. The first bill, Mr. Chairman, is Senate Bill 120. I recommend approval with the substitute. So I move the substitute.
All right, the motion and a second to accept the substitute. All those in favor say aye. Substitute's before us.
Thank you, Mr. Chairman. The substitute directs the Department of Energy in cooperation with the public institution for higher education serving the coalfields region of the Commonwealth to identify the appropriate volume and number of waste coal pipes represented in the coal field. So that was approved by the committee 5-0, and I so move.
All right, you've heard the motion to, and a second to report Senate Bill Senate Bill 120, and that has to go to Finance. So that should be the motion to report and refer to Senate Finance. I have it here on my list. All right, all those in favor of reporting and referring to Senate Finance, say aye.
Aye.
Ayes
All right.
14, no zero.
Thank
Okay.
you, Mr.
Senator
Chairman.
Spruill.
Mr. Chairman, the second bill is Senate Bill 280 by Senator Evans. Recommend approval with the substitute. I so move.
Then a motion and a second to accept the substitute to Senate Bill 280. All those in favor say aye. All right, 280 is before us.
Mr. Chairman, the substitute requires the minion upon the request of a locality within its service territory to provide local liability data within 30 days of such request. And I move to report. Report 5-0 from the committee.
Okay, there's a motion. This can go straight to the floor. Motion to report Senate Bill, to substitute Senate Bill 280. All those in favor, say aye. Vote aye. Opposed, nay.
Ayes 14, no zero.
Ayes 14, no zero. The bill is reported.
Mr. Chairman, the third bill is Senate Bill 347 by Senator Bell. Recommended report with the substitute. I also move the substitute.
All right, there's been a motion and a second to accept the substitute to Senate Bill 347. All those in favor of accepting the substitute say aye. Those opposed, nay.
Mr.
Nay.
Chairman.
All right, substitute is now before us.
Mr. Chairman, we have a one-word amendment on that we need to make at this time as well after the substitute. If the clerk could, it's inserting the word including, if the clerk could read that and ask we vote on that real quick.
Mr. Chairman, Senator Bell, on line 20 of the substitute, after health and safety measures and improvements, strike the word including. So it would read health and safety measures and improvements for the purpose of maximizing both energy savings, et cetera.
Mr. Chairman, we've got all the stakeholders are in agreement with that very exciting amendment.
Okay. All right. All those in favor of accepting the amendment, striking the word including, say aye.
Aye.
Opposed? All right.
Thank you, Mr. Chairman. Then the substitute requires the State Corporation Commission to establish for Phase 2 utilities annual energy efficiency saving target for customers who are lower income. It was so moved by the full committee 5-0, and I so move.
Okay. You have more of an explanation as to what that bill?
Let's see. Yes, sir.
Mr. Chairman, you want me to?
Go ahead, please.
Senator Bell.
Mr. Chairman, this is an energy efficiency bill where
Thank you.
we work with Dominion very closely. They've been a great partner with us with several of the energy groups, and we would identify higher use customers in areas. And then this program would target trying to assist to find the sources and repair if necessary and if possible for low income and also for disabled veterans. And right now, we've kept it pretty limited. Worked with APCO as well. They've been a good partner. And we want to try this pilot for a period of time, which is limited in the bill.
Okay. All right, you've heard the explanation. All those in favor of reporting Senate bills, the substitute Senate Bill 347 as amended, say aye. Vote aye. Opposed, vote nay.
Ayes 15, no zero.
15-0, bill is reported.
Thank you, Mr. Chairman. Next was Senate Bill 659, was similar to Senate Bill 660. It was recommended by the committee to roll 659 into 660. Not so moved.
All right, I think this requires a recorded vote. So all those in favor, merging 659 into 660, vote aye.
Ayes 15, no zero.
Ayes 15, nay 0. 659 is rolled into 660.
Thank you, Mr. Chairman. Now, Senate Bill 660 is by Senator Hanger and co-sponsored Senator Edwards. Recommended substitute. Not so moved, substitute. Did we do that?
Can Senator Edwards here? No.
It's been incorporated.
Yeah, you want to give a
Senator
little
Hanger and
more
Senator
thorough
Edwards.
explanation of what this does?
They were incorporated.
I know they were, but.
You
We're dealing
better
with the
ask
substitute,
Senator
right?
Hanger, he knows more than I do.
Well, he's not a member of the
Mr. Chairman, I
committee.
can tell you what the substitute says, if that'll help.
Okay.
Okay. Well, first, I move the substitute first.
All right, the substitutes before us. All those in favor of accepting the substitute to Senate Bill 660, say aye. Aye. The substitute is now before us.
Thank you, Mr. Chairman. The substitute direct the SCC to convene a stakeholders work group to evaluate Shell solar program for Phase 1 utilities and the Virginia, Maryland, and Delaware Association Electric Cooperative and the Coalition for the Community of Solar Access to jointly convene a shareholders process to evaluate Shell Solar's program for electric co-op. What they're doing, Mr. Chairman, this one is to put Virginia, Maryland, and Delaware together in a corporate together, and they allow them to come together to evaluate the solar program for such programs. That's what it does.
Okay. All right, any questions? All right. There's a motion to report Senate Bill 660 with 659 rolled into it. All those in favor, say aye. Vote aye.
Ayes 15, no zero.
Ayes 15, nay 0. Bill as a substitute is reported.
Mr. Chairman, the next bill is Senate Bill 761. It's recommended by the committee to pass by indefinite 41. I so move.
All right, motion and a second to PBI 761. All those in favor of passing by indefinitely 761, vote aye.
The last bill, Mr. Chairman,
Ayes
last bill
14,
I
no
have
one.
is Senate Bill 762.
14-1, it's
I
PBI.
apologize.
762.
762, Mr. Chairman, recommended by the committee 5-0 to pass by indefinitely. I so move.
Second.
Motion and a second to pass by indefinitely as recommended by the subcommittee. Senate Bill 762. All those in favor of passing by indefinitely. Do you want to speak on that, Senator Suderline?
That's why you have a subcommittee.
You made such quick work of the last one. I think some people's votes would probably disagree with their public positions. On this one, which is about to be passed by indefinitely, this is the same bill that Senator John Bell and I carried the last time we were in this building 2 years ago. Great bill. Great bill. So if you liked Senator Bell and I position then, you should still like it now. Thank you.
Okay. All right. You heard the sponsor.
Move the PBI.
The motion is to pass by indefinitely. All those in favor of passing by indefinitely will vote aye.
Good, John Bell.
That's 14, noes, 1.
That's all I have, Mr. Chairman.
Okay. The vote was 14-1 to pass by indefinitely.
That's all I have, sir.
Yes, all right, thank you, Senator Sproul. All right, next, we're going to hear from the Labor and Employment Subcommittee, Senator Survels.
Thank you, Mr. Chairman. The first bill we have for consideration is Senate Bill number 1. And that was Senator Boysko's bill. That bill would have basically affected every employer in the state and required them to establish a paid family and medical leave program funded by paycheck withdrawals. Senator Boysko gave us about 20 minutes of testimony and evidence and then asked us to carry the bill over to the 2023 session. And that's what I would move to do.
All right, it's been moved and seconded to carry Senate Bill 1 over to 2053 session. All those in favor, vote yea. Those opposed, nay.
That's 15, noes, 0.
Ayes 15, nays 0 to carry it over till 2053. Senator Surville.
Thank you, Mr. Chairman. Senate Bill 15 is the next we have up, and this was Senator Favola's version of a similar concept. This has to do with private insurance for paid family leave. And what this bill would do would authorize the SEC to bless insurance programs that employers could purchase a group policy for paid family insurance. There was nobody who had any problem with this. Everybody thought it was a great idea. And we recommended reporting the bill 3-0, and I would so move. I'm sorry, I'd move the substitute.
All those in favor of adopting the substitute, say aye.
Aye.
All right, opposed? Okay, the substitute's before us.
And I
You
would
want to
move-
give an explanation of exactly what, is it mandatory?
No,
It's not, okay.
no, it's up to an employer. An employer could choose to purchase one of these policies or not.
Okay. All right, you've heard that. The subcommittee recommended 3-0. Motion to report substitute of Senate Bill 15. All those in favor, vote aye.
That's 14, noes, 1.
All right, Senator Surville.
Thank you, Mr. Chairman. The next bill we have is Senate Bill 331, which was Senator Reeves' bill. He asked us to strike that at his request, and I would so move.
All right, motion and a second to strike Senate Bill 351. All those in favor, vote aye.
Ayes 15, noes, 0.
Okay, that's struck. Senator Surville.
Thank you, Mr. Chairman. Next one is my bill, which is Senate Bill 352. First of all, I think I have a substitute. I'd move the substitute.
All right, there's a motion and a second to adopt the substitute to Senate Bill 352. All those in favor, vote aye,
Aye.
or say aye. Okay. You want to explain what we got now?
Yes, sir. So, Mr. Chairman, basically what this bill does is it mandates, it's not an option, mandates sick leave for grocery store workers and healthcare workers. It originally had agency-directed home health care workers that's in Senator Favola's bill we're going to take up in a minute, but I took that out. So it's only healthcare workers and grocery store workers. The grocery stores came to me and complained that the way it was originally written, it didn't pick up the big box stores that also do groceries, and that they thought it would create an unfair competitive advantage for the big box stores selling groceries versus them. So we added the big box grocery store workers to it. That created another headache because some of the people that work in the big box stores do things besides groceries. They'll be in the grocery section, one section, somewhere else in another section. So what we did to fix that was ask Dolly in an enactment clause to provide guidance as to how to treat workers that might work in different parts of the store.
How many days do they have to provide?
That's up to Dolly. Dolly would provide guidance that would provide clarity to the companies as to how to comply with the law.
And it only applies to grocery store workers and healthcare, home healthcare workers.
Healthcare workers, not home healthcare, healthcare. So it applies to hospitals and doctors' medical practices, stuff like that. Not home healthcare, but licensed healthcare providers. That's
So
that's
there's-
basically what the bill does.
And they agreed to this.
Nobody agreed to it.
All right.
Did the subcommittee agree to it?
Yes, Mr. Chairman, the subcommittee recommended reporting 2-1, and it needs to go to finance because there's I think an $800,000 fiscal impact according to the FIS. And so I would move, and consistent with the committee's recommendation, I'd move to report and re-refer to finance.
Senator Norman.
Mr. Chairman, a question of the chairman. Do we still have your unequivocal assurance that this is not the beginning of incremental creep and we're going to add other workers on?
I have zero interest in adding, making this universal or anything else, and I'm pretty sure that the inferior body on the east end of the building would want to do that either, but.
I don't know who you're referring to, but I have a motion to PBI.
Second.
There's a motion and a second to pass by indefinitely Senate Bill 352 as amended. All those in favor of passing by indefinitely vote aye. All right,
Ayes 4, noes 11.
motion fails.
Move to refer and report to finance.
Yeah, I already made that motion. Second.
Move to report and
Mr.
we refer to finance.
Mr. Chairman,
Yeah, Senator Newman.
just speaking, I guess, to the motion, or maybe it's a question, I don't know. But is there any limitation on the size or the number of hours a person has to work? So if you got a two-man operation, you're going to bring all the government with you, and if you're going to work for, 5 hours or 10 hours, or what's the deal? In other words, what's the
Are
small
small
parameter?
employers exempted?
No.
Why?
They're not.
Why? Because, first of all, nobody asked for that, number one. Number two, at least from my perspective, I'm speaking for myself and for the people that brought the bill to me, our grocery store workers were on the front lines of the pandemic. We became aware of how susceptible they are to getting infected when you got to go buy food when something like this is going on. And we thought it was an important policy for the Commonwealth to establish for everybody.
Okay. All right, the motion is to report and refer to Senate Finance. All those in favor of reporting and refer to Senate Finance, vote aye. Those opposed, nay.
Ayes 12, noes 3.
You voted for it. All right, the bill is reported and referred to Senate Finance. All right, Senator Sarvell?
Thank you, Mr. Chairman. Senate Bill 447 is our next bill. This is also Senator Boysko's bill. This is I'm sorry, do we have a substitute for that? Okay, two amendments. I'd move the amendments.
Second.
All right, is a motion to adopt is it one amendment?
It's two amendments. One fixes a drafting error and the other one adds a delayed enactment.
Okay. All those in favor of adopting the amendments, say aye. Aye. Opposed? All right, the amendments are adopted. You want to explain?
I will, Mr. Chairman. So this bill is a very pared-down version of bills that Senator Boysko has introduced in prior years. So this one is much more narrowly tailored. And basically what it does is it basically prohibits an employer from asking a prospective employee about their wage or salary history, or relying on their wage or salary history, or refusing to hire, employ, recruit, promote somebody for not providing wage or salary history in connection with a new hire. Senator Boysko presented significant testimony to us, and I've also actually read things about how not asking about these things during job interviews or requiring to be provided actually results in higher salaries, particularly for women employees. And the rest, her former bills had all kinds of other stuff in it in prior years. This one just limits that alone, and the committee recommended reporting that 2-1.
All right, you all heard the explanation of the bill. The subcommittee recommended reporting it 2-1. There's a motion to report it. All those in favor, vote aye. Those opposed, nay.
Ayes 12, noes 3.
Ayes 12, noes 3. The bill is reported. All right. No, that didn't have to go to finance,
No.
okay. Senate Bill 538, Senator Servell?
Thank you, Mr. Chairman. Senate Bill 538 was Senator Peak's bill. This bill is, I guess, the second fix of a tweak to Senator Ebbins' legislation he passed back in 2020. I think Senator Peterson had a bill last year. This is Senator Peak's tweak. This has to do with the non-payment of wages by subcontractors. And Senator Peak's original bill, first of all, he wanted to make sure that the policy we passed applies to not only generals and subs, but also subs and subs and subs and subs and subs. And so the first set of changes did that. We were okay with that. The other change Senator Peak proposed was that he wanted it to say that if a contractor obtained a piece of paper under oath saying we promise we've paid our employees, they would have a complete defense to a lawsuit. We actually debated that last year and rejected it, and the subcommittee debated that and rejected it again, so we struck that part out, which is what the amendment is. So I'd move the subcommittee amendment.
Which does what again?
It strikes out the language that says if you got one of these pieces of paper, it would be a complete defense in a lawsuit.
That's in the bill now. That's your,
That's the amendment is to strike that out of Senator Peak's bill.
Second.
so what defense would they have?
Well, Senator Peterson carried a bill last year which said that if you get a piece of paper saying that, you can offer it in evidence in court and it's presumptively admissible and a judge can't exclude it. So that we're sticking with the policy that we adopted last year.
Okay. Senator Norman?
Does this just, Mr. Chairman, does this just put us back where the legislation we passed last year and doesn't change anything?
The only thing it changes now, as it comes out of committee, assuming we adopt this amendment, is it makes it clear that this policy applies to subs of subs and subs and subs of subs.
That's if they get a signed piece of paper saying in other words, that their subs and their subs have paid.
Yeah, Mr. Chair.
No, Mr. Chairman, let me try and clarify just so you understand the full context of this. So Senator Ebbins passed the bill in 2020, which basically said that a general contractor can be liable if a
Right,
subcontractor
I
fails
understand
to pay employees. Knowingly fails to pay. And then last year, Senator Peterson passed a bill that said if the general contractor gets a piece of paper from the sub saying, I paid them, they can put that in evidence when they're sued.
Right.
Okay? Senator Peake put in a bill that wanted to make it clear that if a subcontractor of a subcontractor doesn't pay, that the subcontractor can be liable, not just the general. So Senator Peake wanted to make sure that the liability goes all the way down the chain and not just to the general. That's what his bill does if you accept our amendment. We're not changing the policy about the piece of paper being admissible in court.
Mr. Chairman, am I correct that the language, regardless of tier, in Senator Peake's bill remains in the substitute?
Correct.
Okay. The only thing it really does, it puts regardless of tier, so that it's not just
the
privity
general.
of contract, the sub all the way down. Okay,
How does
that's,
the sub get out of liability?
What kinds of subs get out of liability, Mr. Chairman?
No, not what kinds. Let's suppose I'm hired as a subcontractor to Senator Norman we're building a building, and I hire somebody, okay? How do I how do I make sure that I'm not liable because the guy below me the guy I hired didn't pay his workers?
Well, a couple things, Mr. Chairman. I see Senator Peake coming up here to also address this, but number one is you would be careful about who SAS law hires as a sub, number one. Number two, I believe you can bond off that risk and make sure that the sub below you has a bond, performance bond, so that in the event that you have a problem with them, you can go against the bond and recover it so you're not out there holding the bag by yourself. And other than that, I'm not sure if there's anything that Senator Peake might have something to add.
I would say, Mr. Chairman, it is a sign under oath that you've paid them. And so it's not a valid defense anymore, but it can be admitted into evidence. So what the hope is that if they've filled it out and signed it under oath that they've paid their subs, that it makes it easier to find the responsible party who actually has not paid.
Mr.
Because they would
Chairman,
probably not sign under oath that they had paid them if
Well,
they
he said they
didn't.
took that out.
No, that was, we were going to call that, we had called it a valid defense, which was a change from the prior legislation, which said you may submit this affidavit for evidence, but now it's not an affidavit, it is actually signed under oath, well, affidavit signed under oath. It's evidence, but not of, doesn't constitute a defense. So you could still be sued, Mr. Chairman, but it makes it easier to point out to the person suing you, hey, listen, we paid, and they paid. Here's the guy who didn't sign the affidavit under oath saying they paid their employees.
Yeah, all right.
Just cleans it up a little bit, makes it easier to identify
Mr.
who
Chairman.
didn't pay.
can I just say under your hypothetical, the one you gave, right now, Senator Norman can get sued. There's no question about that. What's not clear is whether Saslaw has liability for the subs failure to pay. And this makes it clear that everybody down the chain can get sued, not just the general.
All right. You've heard this bill. Is there a motion?
Move report to substitute.
All right, it's a motion to report the substitute. Is there a second?
Second.
All right, all those in favor of reporting the substitute to Senate Bill 538, vote aye. Those opposed, no.
All right. Thank you, Mr. Chairman.
Ayes 14, noes 1.
Bills reported 14 to 1. All right, 624, Senator Servell.
Thank you, Mr. Chairman. Senate Bill 624 has to do with paid sick leave for agency-directed healthcare workers. This is Senator Favola's bill. Last year, we extended paid sick leave to consumer-directed home healthcare workers. This extends it to agency-directed home healthcare workers. The bill has a $15 million FIS on it, which is why it has to go to Finance. The committee recommended reporting and re-referring that to Finance on a 2-to-1 vote, and I would so move.
Is there a limitation on size of
No.
employers? No.
No.
All right,
No,
Senator Favola, you
And we didn't do
I-
that for consumer-directed
I
ones
just-
last year either.
right.
No, I
okay.
just wanted to add, this is exactly the parallel to what we passed last year, except you
That was
passed.
5 days, right?
It's up to 5 days, and you passed consumer-directed last year. This is the exact same bill, up to 5 days. There would be a general fund implication, and there's also, we
Right.
get non-general fund money because it's Medicaid covered. But I do want you to know that the Medicaid reimbursement to our agencies is also going up. We're increasing that reimbursement.
All right.
So they may not need it dollar for dollar to provide this sick day provision is what my point is.
Okay, you all heard this. Is there a motion? Second? All right, there's a motion and a second to report Senate Bill 624. Was there an amendment?
And refer to Finance. No amendment.
No, and refer to Senate Finance, vote aye.
Ayes 12, noes 3.
Okay. Senator Servell, 646,
Thank you.
646.
Yeah, thank you, Mr. Chairman. Senate Bill 646 is Senator Cosgrove's bill, and this has to do with workers' compensation. Right now, you cannot obtain workers' comp benefits if you're guilty of misconduct. And this makes clear that refusing to get a vaccine does not constitute misconduct or a booster shot. If you may remember, Mr. Chairman, we passed similar legislation of yours finding that failure to get a vaccine disqualifies you from workers' comp. So it's kind of the opposite policy that we've already adopted. So the committee recommended to PBI this by a 2-to-1 vote. I would so move.
The motion to pass by indefinitely, Senate Bill 646. Senator Cosgrove, did you want to talk?
Just very briefly, Mr. Chairman.
Sure.
Mr. Chairman, members of the committee, this is just basically a bill that would allow somebody who is relieved of their employment because they, for religious reasons or physical reasons, could not take the vaccine or did not want to take the vaccine. To say that these people are then going to be put out and not get any unemployment is cruel. These are the folks who can least afford to be without their unemployment insurance, and that's the genesis of the bill, Mr. Chairman. So I would throw myself upon the mercy of the committee.
Senator Morrison.
Thank you, Mr. Chairman. If it's any consolation, we did pass a bill out that dealt with putting employers in the situation of being able to use the Virginia Wellness Act to provide incentives or disincentives, not firings and what have you, but to create an incentive-disincentive situation for those who choose to be unvaccinated. So that's gets you a little bit of the direction you're going in, but...
There's a little bit of a smile.
Huh?
Yeah. Well, just, again, Mr. Chairman, I'm not going to take up a lot of your time, and we know where this is going, but just please understand that the people that are most impacted by this bill are indigent and folks that are black and brown. A lot of them don't want to take that vaccine or will not take that vaccine. If they get fired, they're out of luck.
Vice Chairman.
Senator Squirrel.
Senator Cosgrove, did you also said that for those who will not take the vaccine for medical reasons, are you saying they will also will not be able to get
That's correct.
employment?
Yes, sir.
Mr. Chairman, I'm trying to figure out, and that particular reason, that's one of the particular reasons I agree that for medical reasons, I'm trying to figure out why are we saying, when it was turned down, why are we saying for medical reasons, or religious reasons, and why are we saying that they are not qualified to receive some type of unemployment? If there's a medical reason, I think they should be able to get it. I'm supporting it.
Thank you.
All right, there's a motion that is to pass by Trump. Is there a second? Second. Motion and a second. All those in favor of pass? Substitute motion that we'll vote on first is that the bill be reported. All those in favor of reporting, vote aye. Those opposed, vote nay.
Ayes 4, noes
Thank you.
11.
Thank you, Mr. Chairman.
Ayes 4, noes 11. Bill is not reported. Now the primary motion is to pass by indefinitely. All
Stay
those
for my
in
own
favor
execution,
vote aye.
yeah.
Those opposed, vote nay.
Thank you, Mr. Chairman.
Ayes 11, noes 4.
All right. 769, Senator Serval.
Thank you, Mr. Chairman. Senate Bill 769.
Pass, go to finance.
Yep. This was a bill that Senator Reeves proposed, and I told him he didn't need to be here today, but the original bill as written had a bunch of very extraordinarily detailed requirements for the VEC to try and ensure the VEC was rooting or not paying fraudulent claims, checking various specific databases, et cetera. The committee didn't like the way he drafted it, so he went back to the drawing board and came back to us with a different bill, which I think VEC actually vetted and liked better. We also ran it by JLARC, given the study they just did, and JLARC also concurred that this type of guidance in code would be helpful to the VEC for future reference in terms of preventing them from paying fraudulent claims. So after Senator Reeves went back and rewrote his bill, the committee liked it a lot better, and it basically just requires them to check against, for example, databases of people to ensure people are alive, to check their employment by looking at the child. There's a database that child support enforcement uses to find out where your job is, check for the Social Security database, things like that. But as we all know, there's been a lot of fraud, and we all thought this was a good bill, so we recommended reporting it and referring it to finance on a 3-0 vote. That's I would so move.
All right, the motion and a second to report 769 as amended. And refer to Senate Finance. Vote aye. Those opposed, nay.
Ayes 15, noes 0.
Okay, question, when we reported Senator Favola's bill, we also, 624 go to finance. Is that part of the motion?
Yes.
Yes, sir.
All right, okay. All right, did you have 365?
Yes, sir.
Okay, which has been rolled into 630?
Well, not yet. We're about to.
All right.
Thank you, Mr. Chairman. It says Senate Bill 365 and Senate Bill 631 are tied together. Senate Bill 631 is Senator Barker's bill, which I think we're about to take up. but Senator Barker was unable to make it to subcommittee, so we were unable to either have a hearing or take any action on it. Senator Stewart's bill, 365, is part of Barker's bill. His bill only applies, though, to government employees. And Senator Stewart asked us that his 365 be rolled into Barker's 631 if Barker's bill was going to pass. So that was the motion we made in committee, and then Barker didn't show up. So in any event, I would move Senate Bill 365 be incorporated into Senate Bill 631, and then see what happens with Barker, and if, depending on how that goes, we could always unwind it if we have to. That'd be my motion.
All right, you heard the motion to roll 365 into 631. All those in favor, vote.
Ayes 15, no zero.
Ayes 15, nays 0. Senator Barker, you want to explain this bill?
And that would be my report, Mr. Chairman.
Okay.
Senator Sassler, what are you looking for? Explain 631, is that what you're looking
Yes.
for? All right, yeah, take 631. And apparently I did not pass my course in cloning and couldn't be two places at once, but, for Senator Serval subcommittee. But anyway, what 631 deals with is overtime issue. There is a Fair Labor Standards Act that's been in place since 1938 at the federal level. And we have not had a overtime code section up until just last year. Last year, there was a bill that was introduced on the House side that provided for overtime provisions. And when the bill came to the Senate, what was represented was that it mirrored the Federal Fair Labor Standards Act. And it turned out that that was not correct. That the bill that was adopted then, based upon the statement that it was mirrored the Fair Labor Standards Act, had many different provisions in the bill. So this is an attempt to address that so that we would be taking it to what was what is consistent basically with the Fair Labor Standards Act and starting from that point. What the bill does is it basically takes it so that the individual who feels that they've been not been receiving their share of overtime can go into state court rather than having to go just to federal court, which they've been able to do. There are significant advantages to be able to take a case to state court that are separate from what the provisions of the law are. One of those is that it's often a lot cheaper to be able to come to and to be able to manage things going into state court rather than having to go to the nearest federal court to try to deal with these issues. Secondly, the provisions, there's not a provision in state court for summary judgment, which is advantageous to the plaintiffs in this situation in many instances. And right now, they can get into court a lot quicker. So there are a lot of reasons that are substantive to the process that provide a rationale for having this. What this would do, however, is take the provisions of it to what's in the Fair Labor Standards Act, which would deal with a variety of issues, including who would qualify, who would not qualify, and then also has things related to how much you get in damages and statutes of limitation, because they are different in what was adopted last year from what the federal provisions are. What we want to do is to try to take this to where it is actually what was represented last year when it was presented to this committee during the session. And that at that point, then we could figure out if there are changes that we might want to make in the future on things. Which at that point we could make move to make changes in the future to this what the situation is and how the process would work in Virginia beyond just being what what going into state court. What I want to do is to do a couple things to the bill. One is to, if it passes and gets to the floor or it goes to finance, I will put in a enactment clause that would establish a work group to work on issues that would have wide representation and would have legislators presumably as well as others that participate in that so that we all understand what types of issues are being considered there and have that work group be able to make recommendations on things. Secondly, what I want to do is look at and may be able to do that now fairly quickly is to look at whether there are other categories of employees who are not covered under the Fair Labor Standards Act, but are covered under other federal legislation as to whether those could be rolled in to this provision as well. And with that, I'd be happy to answer any questions anyone might have on it.
Senator
No.
Thank you, Mr. Chairman. For Senator Barker, last year I had correspondence email about the amendment that the airline industry had agreed to, where we carved out airline workers like flight attendants, certain that sort of thing, but that airport workers like wheelchair pushers, skycaps, non-TSA security agents or guards at Virginia's airports and essential baggage handlers were included in last year's bill. And I'm wondering if you're amenable to including that subset of airport workers.
Thank you, Senator Eben. What I was referring to earlier when I said that I wanted to look at how other workers are covered who are not covered by the Fair Labor Standards Act but are covered under federal law. And I think that may provide an opportunity to be able to make that adjustment during the process here, in the Senate in moving forward on things.
So just to clarify, Mr. Chairman, are you open to adding that back into the bill today?
No, I do not have all the information I would need to be able to understand.
What?
I do not have all the information yet as to what the provisions are for the airport workers, so.
So would you be open to doing that when it gets to finance? Does this bill go to finance?
Yeah, we would go to finance, and I would be happy to address it at that point.
Okay, I appreciate the senator's willingness to look at that.
No, not yet, no. I don't have the language. I don't have the
You all
language.
heard the bill. It would have to go to finance. Is there a motion? Move to report.
Second.
And re-refer.
All right, there's a motion and a second to report Senate Bill 631 and Senate Bill 365 over and refer to finance. All those in favor, vote aye. Those opposed, no.
Ayes 15, no zero.
All right, the bill is reported and referred to finance by a vote of 15-0. All right, we now have various insurance bills. Senate Bill 204, Senator Peterson,
Yes, sir.
you're up.
Thank you, Mr. Chair, members of the committee. This is the vertically integrated bill, which kind of out of my greatest hits collection. If I reach back and sort of pull a LP off of the wall and listen to it, it brings back memories of a fond time in my youth. And this would be several years ago when I first started bringing this bill, and it had to do with the Centera/Optima situation in Southeast Virginia. And I want to thank my colleague, Senator Spruill, for raising this issue. And basically, here's the upshot of the bill. And it did get a very full hearing in front of HERC, so I'm not going to repeat everything. But the issue is when a hospital system owns its own insurance company, how do they accommodate other healthcare providers in the region? On what terms do they deal with them? Do they give them the same rates? Are they willing to accept service from any willing provider? And this is the bill that we've had. I think I last had this in 2020. I believe it passed here and then washed up in the House. But this bill effectively does two things in addressing the dual ownership of a hospital and a insurance company. One, it requires two separate boards of directors, and HERC did not like that, and I know Senator Spruill did not like that. So I'm going to go already sort of proffer that that part can be stricken out of the bill, but I want to give it to you as it was introduced. And then secondly, the idea that any willing provider in a network, if they're qualified, if they meet the metrics of care, that they will be recognized. So if, for example, somebody in the Optima network goes to Chesapeake Hospital or somebody in that network, that service will be recognized, and so there'll be a seamless continuum of care for people in that network. So that's the gist of the bill. I know you all have heard it ad nauseum. I've got some excellent lobbyists who understand this issue much better than I do that can speak on its behalf.
Mr. Chairman.
First off, is there questions of the patrons, members of the committee? Senator O'Shea.
Chap, do you
Yes,
have
sir.
any idea how many carriers this would apply to?
I believe this only applies to Optima Centera. I don't think anybody else, and my recollection is it has to be, the hospital has to own a majority of the carrier, and nobody else owns a majority. I think Innova owns half of a carrier, or maybe it was, I can't remember who else, but I believe Centera Optima is the only one that would actually, where you have a majority ownership.
Mr. Chairman, all I would add is the economist in me likes your board of directors part of your bill.
You know what? I liked it too, but people senior to me did not like it.
Mr. Chairman. Mr. Chairman, maybe Senator Barker might be able to remind me, because he serves on the HERC with me, along with you, although I don't think you were at the meeting when we talked about this, Mr. Chairman, but my recollection was when we brought this up at HERC that it was going to get carried over a year and continue to be talked about, and that we hadn't quite finished dealing with it at the HERC. Am I misremembering that, or?
It actually has been a year, so I mean, I'm going back.
Yeah.
There was some discussion along that line. There was not any action taken at that meeting. Senator Peterson was there for a good bit of the meeting, but had to leave a little early.
Mr. Chairman.
So.
Senator Silva. Senator School.
Has this bill been studied one time before?
Yes.
But it has, twice, I believe.
Yes, it has. That's why it was at HERC.
Okay, so, Mr. Chairman, so if it's been heard twice, so unless you just wanted the scrutiny to vote on it, so why you wouldn't heard it again for when you heard it twice?
You know what?
Heard it, and everybody heard it twice.
In the words of Dick Saslow's old Army roommate, a little less talk and a lot more action.
I'm through. Thank you, sir.
All right.
All right. First, we'll hear from the people who support the bill.
Mr. Chairman, if I got a bill at 4 o'clock, so if y'all can keep on talking, I'll present my bill and come back. I certainly appreciate it.
Mr. Chairman, thank you, members of the committee. I'm Curtis Bird. I'm Director of Advocacy for Chesapeake Regional Healthcare, and I know it's easy to see this bill as a Centera Chesapeake regional issue, but that's the way it started out 4 years ago. But in those 4 years, it's turned into something more, and frankly, it's a lot more about policy. Senator Peterson mentioned the any willing provider statute. That is something that's been on the Virginia books for 39 years, and it was created to require, to mandate certain types of providers be included in the panels of carriers, of insurance providers. And that was done to protect the consumer, so that when they purchased health insurance, they had some certainty that certain providers were included in the network. So for example, hospitals. Back in the early 80s, when any willing provider came on the scene, care was very different, the way it was delivered. When people needed surgery, when they needed a diagnostic test, they had to go to the hospital to get that test. Today, it's very different. A lot of those procedures are done in an outpatient setting. And so this bill would, as we say, modernize the any willing provider statute by recognizing the role that those ambulatory services and centers, sites, play in today's healthcare delivery. So it would simply say that those providers who ask to be included into the network of a vertically integrated carrier, they would be accepted into that network contingent upon meeting the quality standards as prescribed by the carrier. So that's it in a nutshell. I think that what's important is that these are lower-cost providers, and very often today, people decide whether they get treatment based upon what it's going to cost them.
All right, any
Thank you.
questions? Okay, thank you very much.
Thank you.
Anyone else here in support of the bill? All right, let's hear from those who are opposed.
Okay. Line them up.
We have a few people behind us, and good afternoon. I'm Anna Healy-James with Centera Healthcare. And just a couple of things. In 2020, this committee did hear the bill, and it went to HERC. So that was the year it went to HERC, and then it was studied this past year, and HERC made a recommendation to study some more, and that was the second time that it went to HERC. I do want to say, if you look at the current version of this bill, which is different than what we've seen in years past, if you look under what the definition of vertically integrated provider carrier, it's a carrier that owns or controls. So it doesn't say it's majority owner. So that's why I have a lot of colleagues here that this does affect, because this is the future of healthcare, of combining the health plan as well as the providers together, because we know it's a lower cost, higher quality path forward as it relates to healthcare. And so you can see Inova has one, Riverside has a Medicare Advantage plan, Mary Washington Hospital, Centra, VCU. So this does focus on a lot more than just Optima and Centera and brings them in. A couple of things, we've been integrating delivery network is what we call it, but a vertically integrated carrier since 1983. And that's when Optima was started. And we have always had Chesapeake Regional in our network. There's not a day that has gone by since we started that they have not been in our network. And currently, we cover all services that they provide and all providers that they own. So everything is covered within the current contract. And so we've had multiple conversations with Chesapeake and asking, what is the problem you're trying to address within this legislation? And we have yet to get an answer. They talk about any willing provider, and this is an update to that language. I will say, if it was really an update to that language, this would apply to all carriers, including United and Anthem, not just Optima, who is a Virginia-based not-for-profit company. So this really puts us at a disadvantage of for-profit, out-of-state companies that do not have to follow the same rules that we do within the bill. And so that's really our main concerns that we have as it relates to, this is just looking at only Virginia-based companies, and we have a huge problem with that and setting an unfair advantage to those outside for-profit entities. Happy to answer any questions.
Mr. Chairman, I have a question.
Senator.
Isn't the key to this that Optima and Centera are not-for-profit?
Yes.
And that's the key. That is a key to this whole thing, not-for-profit versus for-profit insurance.
The key is that it is an entity that has both a health plan and a provider, so hospitals.
And
so that's what it is. But when you look at the bill, who it actually affects are entities that are not-for-profit.
But Optima is not-for-profit?
Yes.
Okay. And you know this in Germany, you're required to have insurance, and they're all not-for-profits.
Mm-hmm.
The biggest problem in this country is they're all for-profits,
Yeah, there's
economically speaking.
Mm-hmm.
Okay.
Those are called surpluses.
Thank you.
That's why it makes it
Good afternoon, Mr. Chairman, members of the committee. Julie Dime on behalf of the Virginia Hospital and Healthcare Association. VHHA is opposed to this legislation or any legislation that singles out vertically integrated carriers. By financially and clinically integrating, there is an alignment for these entities to better coordinate on quality, patient care, and controlling costs. These are all desirable outcomes. Implementing policies that seek to put vertically integrated carriers on an uneven footing will have a stifling effect and place them at a competitive disadvantage with other non-integrated carriers. I'm happy to answer any questions. I think you'll hear from some of our other colleagues and members.
Other questions at this time? All right, next.
Mr. Chairman and members of the committee, I'm Doug Gray on behalf of the Virginia Association of Health Plans. I have several members who would come under common ownership. I have at least 3, but there are probably a lot more. This bill is really not good policy. I mean, the bottom line is that limited networks are how we design at the current time. There are challenges with integrated systems, but this bill doesn't get to the challenge.
All right. Next.
Good afternoon, Mr. Chairman, members of the committee. Kara Gunther with VCU Health System Kara Gunther with VCU Health System. And we do read the language that Anna referenced earlier in her testimony to apply to common ownership, not just majority ownership. So as in years past, we do oppose this bill. And thank you.
Good afternoon, Mr. Chairman, members of the committee. Mike Forehand with Inova Health System. I'll concur with my colleagues and their perspective on this bill. We oppose the bill, and by our read and everyone we've seen, we are covered under the language of the definition of vertically integrated carrier. Thank you so much.
If you are in the Zoom room and wish to speak in regards to this legislation, please raise your hand electronically now. Mr. Chairman, there are no virtual speakers.
Okay. All right. Tom?
Mr. Chairman, Senator Peterson, there's a technical amendment on line 166 after subsection C, strike section 38.2-3409 and insert 38.2-4209.
You've heard the amendment. Is there a second? Second. All right. All those in favor of adopting the amendment? Mr. Stevens is Bill is 204 is amended.
Move to PBI.
Second.
All right, there's a motion and a second.
Mr. Chairman.
Pass 5 definitely. All right, Senator Newman.
Mr. Chairman, I think on this one, I'm probably as much of a truth seeker as any. I've been a little bit on both sides. There are a couple things. One, I'm really disappointed that Herc hadn't really done what we asked him to do, honestly. This is one, it's an important policy decision, and I don't know if Herc's the right ones to do it, but maybe it's something Joint Commission should do. But someone should look at this and see how much the difference is or the delta is between what they're paying themselves and what they're paying others. And that would be helpful information to us, but we just keep getting the bill and we don't get the answers to that question. So I'm pretty disappointed in that. The other is that I understand that Optima and the guys are going through a review now, and they're actually going to sign a new contract with the hospital in question. And so we may be able to know something next year about whether or not they fix the problem. So, Mr. Chairman, I may be the only one. I'm going to make this motion, and y'all just, can just not second it if you want. But I'm going to make a motion that we carry the bill over and we look and see what happens. Number two is that we ask the Joint Commission on Healthcare to take a look at this. Even if it is a staff review, I'd rather not PBI it and not get any more answers again, because I'm inclined to vote yes, but I need the more information. I'd like to know what Optima is going to do. So I make the motion that we, instead of killing the bill, we carry it over, and that we ask the Joint Commission on Healthcare, at least staff, to review it and get back to us.
I'll second that.
All right, there's a motion and a second to carry it over. All those in favor of carrying it over, vote aye. Those opposed, vote nay.
Ayes 4, noes 10, 1 abstention.
All right, primary motion is passed by.
Mr. Chairman, along with the PBI, can the second part of Senator Newman's request, the letter to the Joint Commission rather than HERC, be dealt with?
Tom, you prepare a letter? Okay. All right, the motion will be to pass by definitely the letter from the chairman of her commission to ask them to look at this again. All right, all those in favor of that motion, vote aye. Those opposed, nay.
All right. I'll see y'all next year.
Ayes 11, noes 3, 1 abstention.
All right, passed by definitely 11-3, 1 abstention. All right. Senator Barker, 338.
338. Let me get my mask on. 338 deals with the state taking over on the health.
Realtors bill.
No, this is a different bill. This is that we passed last year to establish a state-run reinsurance system. To establish a reinsurance program which would be operated at the state level which would cover basically the Affordable Care Act, the acquisition of health plans there. We passed legislation last year to move to do this reinsurance program. There was a provision that was written into the law that dealt with two issues that are done at the federal level, or authorized at the federal level under the Affordable Care Act, that would, in effect, shift monies from one insurance company to another insurance company. The Bureau of Insurance has indicated that they could not do specifically what was stipulated in the law that was passed last year, because on one of the two provisions that are shifting of funds from among insurance companies, it's done on an aggregate basis and not an individual basis. And what this required, what the legislation required last year, was to do that on an individual basis. And so there are two minor changes that are made to what was passed last year to take that provision out. There may be other ways to address some of the issues that have arisen, but what was done was that's not the way that the system would work, and the Bureau of Insurance is strongly supportive of this proposal.
Any questions of the figure? Members of the committee? All right, those here to speak in favor of the bill. All right.
If you are in the Zoom room and wish to speak in favor of the bill, please raise your hand electronically now. Mr. Chairman, we have one speaker, Mr. Bradley Marsh.
Okay, quickly, Mr. Marsh. You in favor of it?
He's just there to answer questions.
He works with the Bureau of Insurance, so.
Mr. Marsh, you can unmute and begin your testimony.
Mr. Speaker, Brad Marsh, the Bureau of Insurance. I was just logging in case there were questions for the Bureau. If not, everything what Senator Barker said is fine.
Thank you for being here. All right. Okay, you've heard it. The bill's before us. All those in favor of reporting Senate Bill 338, vote aye. Opposed, nay.
Ayes 15, no 0.
Ayes 15, no 0. All right, Senator Donovan, you have three bills.
How you got three bills at this point?
Mr. Chairman, thank you so much. The first bill we'll talk about is 428. And this is the bill that we promised to come back to you with Peace in the Valley, and we have. This is a really good business efficiency bill. What this is going to do is it's going to create a real-time connection between a doctor's EMR and the health plan, so that while there are thousands of Anthem health plans, and I don't know what your plan says, this will give me real-time information. This is going to reduce the cost of health care by making sure that when a prescription is being written, we have real-time prescription costs for that patient. I'll point out to you, and you know this, I'm certain, but there is not a cost of a medication that is universal, so I know what is less expensive. When you have a prescription you prescribe, it may be $2 on one insurance plan and it may be $200 on another. So it has to do with the individuality of the insurance plan, and that's information I don't have access to in my office every day. With this, doctors will have real-time access to the cost of prescriptions for their patient based on the plan they have. Real-time prior authorization, that's going to take some committee work, but other states have done it where they've come up with a universal prior authorization, so we'll know real-time for the patient, and real-time patient co-payment expenses based on their deductible and their co-payment. And that's why it's such a good business bill. Those are the three things that it does. We have changed the language. There's a substitute, Tom, I believe.
Yes, ma'am.
Substitute that accommodates all of those parties so that we have that agreed upon language. And if you'll move the substitute, I think we can hear from.
There's a motion and a second to adopt the substitute. All those in favor say aye. Aye. All right, the substitute is for us. You want to give us just a practical example of what this bill does.
Certainly. So, Mr. Chairman, if I have a patient in my office, when they walk in the door, my team will be able to look and say, your copayment today is $25, or you've met your deductible and you don't have to pay anything, instead of saying, we're going to check with your insurance plan and we'll get back to you later. When they come into my office, we're going to sit down, figure out what their health plan is, and then we're going to pick a prescription. And I'm going to be able to see, as I'm electronically prescribing that prescription, exactly how much my patient's going to pay. And if I pick one medication from a family of meds and it's $200 for that patient, I'll say, hey, this one's only $2. I suggest we go with this alternate medication. And they may say, no, I like the other one. I'm going to pay the $200. It's okay with me. But they will know what it costs. Right now, they can't rely on the physician determining that for them. They have to wait till they get to the pharmacy, and then if they want to talk to the physician again, they may have to call back. Finally, if that is a prior authorization, you've heard about step therapy, you've heard about prior authorization for surgery. That's a little separate but linked. But for that medication, if they say you can't have that medication until you've tried 3 others, I can actually put that through the insurance plan with hopefully we're going to come up with a universal prior auth process so that all health plans will use the same. And instead of my staff taking an hour on hold on the phone to get that prior authorization done, we can do it electronically and universally.
All right. Senator Marston.
Thank you, Mr. Chairman. Senator Donovan, this doesn't appear to have anything to do with the actual pharmacy. And do they ever charge different prices here? You're not researching and sending people to specific locations or pharmaceutical chains?
Mr. Chairman and Senator Marsden, no. The pharmacy has access to this information now, so that if you go into the pharmacy and they have the ability to substitute a generic, which is what we rely on for the patients, but it doesn't always work. But if you go into the pharmacy, they have what I want in their connection with the health plan, and they're able to say your copayment for you in this with your deductible is going to be whatever it is. But if I can give you this, and that'll be $2. We'll be able to do the same thing in our office, so we prescribe the right thing and we make sure, but it doesn't have to do with any of the coupon things.
Thank you.
Mm-hmm.
All right. Any other questions of the patron? All right. Those here who are in favor of the bill.
Mr. Chairman, Scott Johnson for the Medical Society. This is one of those moments that Mars and Venus align, because you've got the doctors, the hospitals, and the health plans have come together to work on this. We've got a lot more work to do, and that's why this work group needs to act and come back. But it's a #1 complaint. It's a lot of work on both ends, on the doctor side, the hospital side, and the health plan side. So we ask your favorable support of this.
Okay. Doug?
Mr. Chairman, Doug Gray, on behalf of the Virginia Association of Health Plans. This is an effort to bring real-time benefit tools and the data that's involved, and electronic prescribing and electronic prior auth all together, and make everybody use them. So you may remember a while back we required that opioids be done with an electronic system. We're doing a similar thing here, and it'll take 3 years. At a minimum to get there. 2025 is what's in the bill.
Senator Norman.
Mr. Gray, do you support it?
I do.
You didn't say that. I like to hear things, okay?
Mr. Chairman and Senator Norman, we support the bill.
So the effective date of this is going to be 2025. All right. Next.
Mr. Chair, members of the committee, Michelle Satterlin on behalf of McKesson. And we first just want to thank Senator Donovan. This is not an easy bill to work on. It does move us forward in terms of transparency at the point of prescribing. I do agree with Scott and Doug that there's going to be continued conversations about this, but this is a positive bill in terms of moving the conversation forward, and we support it.
Okay.
We support it.
All right. Is there anyone out
Thank you.
there opposed to the bill?
If you're in the Zoom room and would like to speak in regards to this bill, please raise your hand electronically now. Mr. Chairman, there are no speakers virtually.
I have one question. I don't know if it can be answered, but
Senator Edwards.
What about the pharmaceutical companies?
Mr. Chairman and Senator Edwards, they have a relationship with the health plans in negotiating what the costs are, but they're not relevant here. It is a 3-year enactment process because we have to align prior auth, and we need to give EMRs an opportunity to create the links that they have to, just as we did with narcotic prescribing.
All right, substitutes before us. Is there a motion? All right, there's a motion and second to report the substitute of Senate Bill 428. All those in favor vote aye. Opposed, nay. All right,
Ayes 15, no zero.
ayes 15, no zero. 428 as a substitute is reported. Next is either 407 or 681.
Thank you very much, Mr. Chairman, and I'm not sure what the third bill is, but I'm going to figure it out in a minute. But 407 is the next bill before you.
That was Obenshain's bill. That's my fault.
Okay, no, that's okay. Mr. Chairman, 407 does also have a substitute.
All right, there's a motion and a second to adopt the substitute to 407. All those in favor of adopting the substitute, say aye. Aye. Opposed? All right. The substitute's before us.
Mr. Chairman, this bill is brought to you today to clarify a bill that we passed 2 years ago, and that is a bill that would direct disability insurance for the new plans that they write to ensure that the disability income protection reimbursement for maternity leave was 12 weeks. And apparently, despite the intent and what we thought we were passing, that was not completely interpreted in that way. And there are disability plans that are actually offering the 12 weeks. Many of them don't offer it unless an additional disability besides childbirth is offered. They're only giving the 6 to 8 unless a doctor writes for another disability. And really, Mr. Chairman, the intent of the committee and the Senate and me was that this be the amount of disability time and to have it built into the plans going forward. That is what this language now says. It is redefined that it, despite notwithstanding a disability or a medical necessity, it's 12 weeks of income protection. Mr. Chairman, for the insurance plans that have instituted this, they have published reports that I have with me that show there's very little cost associated with this. I know you have seen and passed another bill that talks about an additional product that can be purchased by businesses across Virginia for FLMA, but not all businesses will purchase that. About 40% of Virginians have disability included as a business benefit, as an employment benefit, and some of those have maternity coverage, but we should have consistency across the board of what we expect is appropriate maternity coverage, and it should be represented in the disability plans that we're writing, and it should be represented in the FLMA plans that we're writing as well. And so, Mr. Chairman, to correct this problem, I hope this bill will see fit to pass this legislation.
All right. Any questions of the patron? All right, is out there in the audience. If you're in favor of the bill, come forward.
If you are in the Zoom room and wish to speak in support of the bill, please raise your hand electronically now. Mr. Chairman, we have one speaker in support, Lee Iandrick.
Go ahead.
Good morning, Mr. Chairman, members of the committee. My name is Lee Bedricki. I'm the president of Benefinder. I've been a licensed life and health agent for approximately 20 years. In that time, we've seen numerous instances where the disability has been a detriment, meaning not enough time available by the benefit duration defined by these policies and carriers. And I wholeheartedly support Senator Dunavant's bill. As a result of the language from the last year, we've seen some carriers that are unfavorably priced because they chose to interpret the language correctly. Other carriers have maintained a pricing advantage, and I think it is important for Virginia to lead the way on behalf of mothers and infants.
All right, thank you very much. Is there anybody here in the audience that was opposed? All right, you're opposed. All right, tell us why.
Yes, Mr. Chairman, members of the committee, Patrick Cushing on behalf of the American Council of Life Insurers, and we represent the companies that sell disability policies throughout the country. We're opposed for a couple of reasons, but first and foremost, I want to start by saying that the extra time between that 6 to 8 weeks and 12 weeks is a critical time for the mother and the family, and we have no disagreement with that from a policy standpoint. What we disagree on is how that is implemented within this bill. And one of the issues that I want to talk about is what short-term disability policies cover and why they cover them. In the case of childbirth, there is no state in this country that mandates that disability policies provide 12 weeks of coverage automatically. Now, what Senator Donovan passed in Senate Bill 567 a couple of years ago that created this code section was language that would require short-term disability providers to provide 12 weeks upon a finding of disability beyond the 6 to 8 weeks. And that finding of disability is what this insurance product is. It's a disability product.
But why wouldn't you charge for that? In other words, you know, if you feel that it's excessive, why wouldn't it just cost more?
It will cost more.
Right.
It will cost more. But what we are constrained by is the definition of disability within the American Disability Act. And let me read this for you. Under the ADA, you have a disability if you have a physical or mental impairment that substantially limits a major life activity. To be protected under the ADA, you must have a record of or be regarded as having a substantial as opposed to a minor impairment. Now, it's unfortunate that we call childbirth a disability, but that's the world that we're living in. And so with Senator Donovan's language that has been in the code, we do have a system in place where a mother can get 12 weeks after that 6 to 8 week time frame. All that has to happen is a doctor that says that this mother is disabled. She has a major life impairment, cannot return to her normal work functions. So it's not the disagreement over 12 weeks being the best for the mother and the child. It's a disagreement as to how we get there. And Senator Donovan mentioned, and I think almost everybody in this room voted for Senator Favola's Senate Bill 15, which created a framework that has been brought forth from the insurance industry to help get to that 12 weeks. And that's creating a new set of insurance language to establish family leave plans in Virginia as an insurance option. The other thing that I would mention is that this covers, by focusing on the disability market, you're covering a small subset of women in the Commonwealth. And from the life insurance and insurer perspective, we have no objection. I think you'll get maybe objections from the business community with a mandate on all employers. It's just how this is being done within this bill. I will stop my comments there because I also have somebody from ACLI who has some more experience on this online, so I'll save my time for her. But I'm happy to answer any questions.
Any questions of Mr. Cushing? All right.
If you are in the Zoom room and wish to speak in opposition to the bill, please raise your hand electronically now. Mr. Chairman, we have one speaker, Michelle Foster.
Okay. Welcome, Ms. Foster.
Ms. Foster, you can unmute and begin your testimony.
Perfect. Good afternoon, Senator Sass-Law, committee members. My name is Michelle Carol Foster. I'm with the American Council of Life Insurers, and I'll be very brief in my remarks. As Patrick or Mr. Cushing just mentioned, this bill would amend the former Senate Bill 567, which was enacted into law in 2019. When this bill was first introduced, our members had concerns as outlined by Mr. Cushing, and the major concern was adding what appears to be bonding time to a disability income policy. ACLI, as Patrick shared, we're all for working Virginians having the ability to take leave for both partners for birth or adoption of a child. And as such, we've worked, as Patrick also mentioned, for 2 years to develop Senate Bill 15 that was just passed out of committee. And this will actually allow and create this benefit for not only the mother, but also for fathers to care for their newborn children, parents to care for sick kids, as well as children in care.
Wrap up.
Yep. So we believe that this bill, Senate Bill 15, will help alleviate the concerns of this bill. And I would respectfully ask that this subcommittee defeat or take no action on this bill.
All right. Again, the question that I have is that why wouldn't you take care of this? Well, if you offer up this policy, offer it up at more expense than you normally might. I don't understand what the problem would be.
Mr. Chairman, members of the committee, the cost is a concern. I think what you'll find is this is a voluntary product purchased by employers, and increasing the cost for this additional mandate is going to price potentially some employers out of the market. So we do have concerns about that. But in addition to the pricing component, we're concerned about Equal Employment Opportunity Commission complaints. When you have a situation where one individual is provided a type of leave that is not medically necessary in terms of the definition of disability that I referenced, you have concerns about folks who are in similarly situated situations. This could be in the case of a father filing a complaint within the EEOC for discrimination. So it's one of the other concerns that we do have.
Mr. Chairman, I have a question.
Senator
It seems
Edwards.
to me the biggest question, you say the definition of disability within the Americans with Disabilities Act. We don't necessarily need to be stuck with the definitional issue, do we?
Mr. Chairman, Senator Edwards, we don't, but I would remind this committee of an earlier remark I made is that, within the 50 states, there is no state that sets a 12-week mandate for a mother after childbirth. So we would be the first state to do that. What insurers rely on are a series of recommendations and private entities that come together to determine what a medical standard is for leave, whether you have an appendectomy, whether you have a child, if you have a broken leg and what kind of broken leg. There are guidelines that all of the states rely on and all the insurers within the states and our regulators, the Bureau of Insurance, rely on when looking at these policies. And so this would be a pretty significant departure from that practice within the 50 states.
Yeah.
Senator
Why are we stuck with doing what other states do? This is Virginia. We're special. We're a Commonwealth. No, seriously.
Absolutely.
We make the law, don't we?
You do. You do. I'm not disputing that Virginia could be the first. I mean, that's within your
Mr. Chairman.
jurisdiction.
Senator Servo.
Thank you, Mr. Chairman. Could I, in response to what Senator Edwards asked, I guess this is a question to Mr. Cushing, but partly what these companies do is they have actuaries that figure these things out, and the broader the pool you're in, the easier it is for them to figure out how to adjust their risk. And if we have a policy that's totally different from everybody else's, it requires a whole lot of work and guesswork to try and figure out exactly how to price a policy because we have something in it that nobody else covers, right?
Yeah, Mr. Chairman, correct.
All right.
Mr. Chairman. Mr. Chairman.
Senator Mason.
Thank you, Mr. Chairman. So a moment ago, you talked about the 6 to 8 week payment, and all the doctor has to do is write a note to say you need. Is disability covering that 6 to 8 week period?
Yes.
And the 12 if it's written.
Yes, and under our existing law today, if a mother is a natural birth 6 weeks, 8 weeks for cesarean, at that point, if that mother goes back to her doctor and has severe postpartum depression or any number of limitations that would qualify in the professional opinion of a doctor as a disability, that mother can get to 12 weeks under the law today. All it requires is a medical doctor finding a disability. And what is happening with this bill is you're taking away that individual medical opinion of that mother's doctor and replacing it with this body's determination that 12 weeks is the automatic disability determination under this insurance product.
So, Mr. Chairman,
Senator Mason.
so you have to have another difficult situation going on in order to, but when you started, you said you don't disagree that this period of time is so critical with the mother and the child,
Right.
but you have to have something wrong. I mean, so in order to get the additional 4 weeks, I mean, something significantly wrong that a doctor diagnoses.
Mr. Chairman, Senator Mason, correct.
Thank you, Mr. Chairman.
Mr. Chairman.
Senator Bell.
Question, I don't know if you can answer this, Patrick, or if the lady was on the Zoom a minute ago, but could you speak to, if we were the only state to have this, would disability insurance providers perhaps be reluctant to provide service in Virginia? Do you think people would leave?
Mr. Chairman, Senator Bell, I can't speculate as to what happened. I know after talking with my client, I mean, this is a very significant concern of our member organization, which includes insurers that write these policies in Virginia. I hate to throw out things like you're going to see insurers leaving the market, but I think that's one possible outcome.
Mr. Chairman, I would love a chance to respond to
Okay.
a few of these statements.
All right.
Thank you. I will start with a publication from a provider in Virginia that actually provides the 12 weeks coverage, and it says, And the new benefit will have a small impact on short-term disability rates. I will further tell you that disability is the period of time that a doctor says somebody is the appropriate amount of time to recover from any medical event. I fill out disability papers on every patient that has a baby. And those, when you talk about guidelines about best medical evidence, the best medical evidence is that it's 12 weeks is necessary to recover from the medical event of giving childbirth, which is what this benefit is constricted to. So there's not going to be any question about whether or not this is fair unless somebody else has given birth to a child, because it's a medical designation. So, of course, the insurance plans want to have the new product that we are allowing to come into Virginia now, FLMA, bought on as an adjunct to what already exists. But many businesses will not be able to afford that and will not provide that. And we will have a disparity between what is the appropriate recovery time for the medical event of childbirth, and it is 12 weeks medically, and we can make it law in Virginia. It's the right thing to do. It's not costly. We have evidence of that from people who have instituted this from the bill we had from a couple of years ago. And I hope that it will be the will of this committee to move this forward and perhaps be the first to do it, because it's the right thing to do and it's what everybody should be doing. The plans have not left yet, and that many of them have already been implementing this. But there's confusion because there was not an agreement that childbirth alone was the sufficient disability for the 12 weeks, and they were requiring an additional disability. That's what this language does, is it fixes it. If there are any other questions, I'm happy to answer.
All right. Mr. Chairman, before we do that, if you don't mind, question. Siobhan, couldn't you, or are you mandating a rider? In other words, couldn't you just say you can, employee, you can have your disability, or here's the rider that you can buy? In other words,
All of the above. But right now, maternity is a rider on disability. Not all disability plans include maternity. That's why we're defining it here specifically. For those that include maternity, it will be 12 weeks whether your business buys only disability or if they buy the rider, which can be a part of the bill you have passed through, Senate Bill, I guess, 15, or it can be a completely separate plan. But we can't leave those that have only this in my estimation of not having the appropriate disability recovery time from the medical event of childbirth.
Okay. Bills before us, 407 as a substitute.
I move to report the bill from others.
Yeah, 407. Motion,
I move to report the bill from others, Senate Bill 407.
all right. Is there a second for the moms? All right, there's a motion and a second. All those in favor of reporting Senate Bill 407 as a substitute, vote aye. Those opposed, nay.
Ayes 9, noes 6.
Ayes 9, nays 6. The bill is reported.
Thank you, Mr. Chairman, members of the committee.
All right. Senate Bill 681, Senator Obenshain.
Mr. Chairman, this bill was before us last week, and this is the bill dealing with how medical expenses are billed following an accident. And we have a substitute that I think resolves all of the questions. Tom, do you have that?
Yes, sir, Mr. Chairman, Senator Obenshain, it's available online now.
I move to adopt the substitute.
All right, motion and second to adopt the substitute to Senate Bill 681. All those in favor, say aye.
Aye.
Opposed? All right.
Mr. Chairman, what the substitute does is it simply says that failure to follow the requirements already in the code is a Consumer Protection Act violation if the failure is knowingly done. That's it. That incorporates Senator Servell's suggestion, and I'm not aware of any opposition to it.
Okay. Are there any questions of the patron, committee members? All right, the audience, anyone have a desire to speak either in favor or against?
If you are in the Zoom room and wish to speak in regards to this bill, please raise your hand electronically now. Mr. Chairman, we have no electronic speakers.
Okay, bills before us.
Move to report.
Motion and a second to report 681. Did we amend that? Substitute, okay. All right, all those in favor of voting for 681 as a substitute, vote aye.
Ayes 15, no zero.
Ayes 15, no zero, it's reported. All right, we got three more bills. Senate Bill 329, Senator Bell, that's yours.
Thank you, Mr. Chairman. We have an amendment on this, or actually, I think it's a substitute. I want to go ahead and move the substitute.
All right, motion and a second to adopt the substitute, Senate Bill 329. All those in favor, say aye.
Aye.
Opposed? All right, it's the substitutes before us. This bill deals with credit unions.
Mr. Chairman, this really simplifies the process by which a state-chartered credit union can engage in activities, service, or practices authorized for federal credit unions. And the amendment, or the substitute we just did, basically just gives further clarification and code references on this. We've worked with the bankers and other stakeholders. Right now, we think we have agreement on it. The only possible area was some of the treasurers wanted to look at the wording on it, and I promise to continue to work with them as it goes forward. But at the moment, I think we have no disagreement on the bill.
Okay. All right, you heard the patron. Does anybody have any questions? All right, audience, anybody with a desire to speak?
If you are in the Zoom room and wish to speak in regards to the bill, please raise your hand
Welcome, state
electronically
your
now.
name and
Hi, my name's Carrie Hunt. I'm the president and CEO of the Virginia Credit Union League.
you who?
Carrie Hunt with the Virginia Credit Union League.
Okay.
I want to thank Senator Bell for introducing this important piece of legislation. Clearly, we are very much in support of the bill. There are only 23 state chartered credit unions left in Virginia, and this will help in providing parity and a strong dual chartering system. I'm
Okay.
happy to answer any questions. Thank you.
Any questions? All right, thank you. Anyone in opposition? All right, no one in the, what about in the hearing room?
If you are in the Zoom room and wish to speak in regards to this bill, please raise your hand electronically now.
Move report.
Mr. Chairman, there are no speakers.
All right, there's a motion and a second to report Senate Bill 329. All those in favor, vote aye. Opposed, nay.
Ayes 15, no zero.
Ayes 15, no zero. 329 is reported. Senator Somerville, 565.
Thank you, Mr. Chairman. I apologize for upsetting the rapid pace we're at here. This one's a little more complicated. First of all, I have a substitute, which I would move.
All right, there's a motion and a second to adopt the substitute to 565. All those in favor say aye. All right, you want to explain the substitute, what your bill does, Senator Somerville? You're
Yes,
up.
Mr. Chairman. This bill has to do with curbing methane emissions. For those of you, I've been learning all about methane lately, but methane is 85 times more effective at capturing greenhouse energy than carbon dioxide. And methane comes out of lots of places. According to the UN, about a third of methane emissions worldwide come from fossil fuel extraction, about 27% from livestock, about 16% from landfills, some from burning, rice agriculture, and biofuels. When DEQ looked at it in Virginia, they found that in Virginia, about half of our methane emissions comes from coal mines, 38% from landfills, a little bit from paper, and then the rest comes from a hodgepodge of things like natural gas systems, electricity generation, and some others. In November, at the UN Climate Conference, COP26, President Biden signed a pledge promising to reduce American methane emissions by 30%. And, Mr. Chairman, EPA is going to be coming out with regulations in the next 12 months to 2 years requiring the reduction of methane emissions in America. And basically what this bill does is it gets us a head start on that. So the bill basically allows Virginia's natural gas companies to reduce methane emissions, or to partner to reduce methane emissions in Virginia in 3 ways. Number one, It allows them to get credit and recover the cost from customers of reducing methane emissions from enhanced leak detection on their existing systems. So they use technology to reduce the leaks out of their pipes and compressor stations they're using today. That's the first method. The second method is to purchase and sell to consumers certified low-emission natural gas, which has been certified by a third-party NGO to produce methane using low-emission methods. And the third is by selling biogas, biomethane, to consumers. And that's methane generated from things like composting facilities, or sucking it out of landfills, or getting it from feeding operations for livestock, things like that. And which, by the way, all this is going on up and down the East Coast. So if you look at the bill, basically the beginning of the bill, right at the beginning, there's a statement of policy that's guidance to the SCC. Lines 25 to 27 defines what biogas is, which is this new kind of gas that's, again, created biologically instead of extracted by fracking. Lines 28 through 32 define what low-emission natural gas is. That's the gas that's been certified by the third party that it's manufactured or extracted using low-emission techniques. And then the meat of the bill, in terms of the changes in law, happen after lines 432, I think, which talks about biogas. And just so I'm clear, or we're all clear, none of this tells the SCC that they have to do anything. Nothing mandates to them that they have to approve a project. Every single biogas project that an LDC chooses to engage in they'll have to show that how much methane it's projected to recover. They're going to have to show how much it's going to cost, and over a period of time, so they're going to have to show, cost-benefit return, and the SCC is going to have to evaluate and decide if that's in the best interest of ratepayers or not. So it doesn't tell anybody to do anything. I think you're going to hear the concerns I've heard are basically a couple different things. One is, and you're probably about to hear, one is that it allows the companies to use gas created by combined feeding operations, things like pig farms, chicken farms, or maybe cattle farms. Those farms have pollution issues, I guess.
How do they capture that gas?
They put it in a big tank. They take the stuff out, put it in a tank, and throw some stuff in to make it perk. The methane goes into a pipe and comes on out.
Well, how do they capture it in the air from animals and things?
They don't get it from the animal. They get it from the waste the animal generates. They take the animal waste and put it in the tank, and then it generates methane.
Okay.
We're not talking about putting a gas mask on a cow and having it, pulling it. Because, by the way, the methane from cows is from cows burping, not cow farts. That's a common misconception. This doesn't have anything to do with cow burps, by the way. This is about waste. So
I get the picture.
Got it. It's a very vivid picture, I know. In any event, but that's what the combined feeding operations are. The pollution issues with CAFOs and all that, that's a different issue, okay? And so, in any event, they're doing this up and down the East Coast for these combined feeding operations to capture the methane. And from my point of view, if the methane is going to come out and be in the air, it's a lot better to put it in a pipe and use it to heat homes, cook with, or heat water than it is to have it just floating around the atmosphere, heating up the planet. And the pollution issue is a different issue. The second thing you're going to hear is a concern that making these investments, that the SCC could improve something and methane won't come out of it. And that's something the SCC is going to have to figure out. These companies are going to have to show the SCC that we're going to build this thing, methane's going to come out, and it's cost justified. And from my point of view, you either trust the SCC if you don't. If you don't trust the SCC, then vote against this bill. If you trust the SCC to do what we've hired them to do, then the SCC will figure this out. And if the project didn't justify, they won't approve it. So, and the last thing, Mr. Chairman, is there was some concern. Some people wanted us to build goals into this to say that we're going to have a 25% methane reduction goal in Virginia. And the problem with that is methane comes from lots of places in Virginia. And the 5 gas companies are at different places in getting to net zero, and just slapping all of them with a 25% goal isn't fair because some of them are further along than others. And so you can't, this isn't like the VCEA that we passed a couple years ago. It's a different industry, whole different model. And so that's for another day. So that's basically what the bill does. In ag, there are about 20 people lined up behind me in support of it. since then, some opposition has materialized, so you're going to probably hear from them. And I'm happy to take questions, and there's a lot of people here that can answer questions as well.
Thank you. Senator Servell, in Fairfax, at the landfill, Covanta extracts methane and creates right on the premises. They burn it, create electricity, sell it, and what have you. This doesn't deal with that. This is actually capturing it and transmitting it or transporting it some distance through a pipe to some other location where it's done. Is that correct?
Through a gathering line. And a gathering line, you're typically talking like a 4-inch pipe that they put in with like a ditch witch or something. We're not talking about tearing down tons of trees and digging a big trench. We're talking about a gathering line. But they could take that methane, instead of using it to make gas, they could take it and put it into the pipe and sell it. And I would also just note, by the way, the municipalities are also interested in this because they could put these systems on sewage plants. So, you could put on some of the Fairfax County or Arlington County, Alexandria, whatever, sewage plants, and take the methane out of that, monetize it.
Mr. Chairman?
So you get more from that or from farm animals, which.
Right, that's right.
Mr. Chairman?
So technically, you are BSing us.
Technically, I might be, you're right.
Mr. Chairman, I have a question.
Mr.
Chairman.
Senator.
Just as a follow-up, so the only difference between here is that Covanta chooses not to take it very far, so it's already being done. What your bill
On the
will do is
landfills-
already being done, it's just not being transported very far.
In some places, but this might make it feasible. For example, the Prince William County landfill on 234, they could put a methane capture system on that, get it in the pipe. They don't burn it in Prince William.
So theoretically, Mr. Chairman, they could send it to Fairfax, and Fairfax would burn it at their facility and do it that way.
In theory, although I don't think it's.
I don't think they'd do it either, but
Right.
that's what we're talking about here. Okay, thank you.
Mr. Chairman?
Senator
My understanding, you can take this out of landfills and transport it, correct? They take this biomass out of landfills and then send them through the pipeline.
This would allow a natural gas company to propose to put a methane capture system at a landfill and then run the methane through a
Right.
gathering line into their
Right,
system.
Yeah, I'm aware that happens.
Senator Norman, then Senator Newman.
Senator Servell, I don't have any idea if this has anything to do with it. Sometime in the last couple of weeks, I heard a debate on the radio. Does this in any way involve the propane industry? Because it does not part of that squabble?
No, there was some bill, I think, that had to do with converting appliances from propane to gas, and I think that was Senator Hashmi's bill, I think. I don't think that was this one.
My second question is a little more provocative. You indicated that President Biden has made some representations on it, and I don't understand why we in Virginia want to rely upon that and get out in front when I look and see what's happened on the BBB legislation, voting rights, and Afghanistan. Why do we want to get out in front? Because he really hadn't, been able to perform on some of these major issues.
I would tell the senator, Mr. Chairman, that the industry is already starting to do this without the regulations coming from President Biden. I believe they've approved a similar project like this in Illinois. And there's actually a rate case pending, I think, from Virginia Natural Gas to do a version of this that was filed about a month ago here. So this creates a structure that's a little clearer gives the SEC guidance about it.
Mr. Chairman.
Senator Newman's next.
Senator Servell, it seems to me this bill has, as far as the amount of energy impacted, has very little to do with biogas or anything else. The big impact on this bill is on the traditional fracking and the leak detection and all that for that side. Because, having had a city where we had this biogas in our landfill forever, it produces enough to help us offset a little bit some of the sewage costs. It's not much, right? So that's just little, and I imagine farm is little too. The basis of your bill is fracking and how you keep leak detection and how you go through the process of monitoring those sources for methane. Is that correct?
Well, there's smarter people that are behind me that could probably further elucidate that for you, but my understanding in talking to them is that the lowest hanging fruit amongst the three sources is the low-emission natural gas. That's the easiest to get. And that's the natural gas that's generated and certified as being generated using low-emission methods. Because a lot of the, as I told you, I mean, what the UN said is that 1/3 of emissions worldwide come from fossil fuel generation, like at the wellhead, leaky wellheads and stuff. And so the certified gas, they've plugged the leaks at the wellhead.
So let me ask you
think.
the key question. What's this going to do to the cost for gas for consumers, since farms and bio doesn't matter much because it's not much there, it's a little pots. What's the cost going to be that's going to be now passed on to consumers if your bill passes as opposed to what it is now?
Mr. Kibler's done some calculations of that, which he could probably better to explain than I could, but
Mr. Chairman,
if you want to ask him the question, he can answer it.
I have one
Senator
question.
Edwards.
Yeah, there are already some federal incentives for doing this. That's my understanding. Am I correct? Federal incentives, tax incentives or whatever?
I'm seeing nodding heads.
Currently?
I'm seeing nodding heads behind me, but
Okay, all right. I
but you
understand
can't
there are.
recover the cost from ratepayers without SCC approval, and this creates a structure to do that.
Okay.
All right, okay, those in support of the bill who are here today, come forward.
I would encourage Senator Newman to ask Mr. Kibler that question he asked me.
If you are in the Zoom room and wish
All
to
right,
speak in
there's gonna be a
support,
total
please raise your hand.
of, for the people in the room, 3 minutes for and 3 minutes against. So there's about 6 or 7, so you really got to move it. Go ahead.
Yes, sir, Mr. Chairman. Jim Kibler, I'm an unpaid advisor to Senator Servell. Senator Newman, your question is the cost to ratepayers. I calculated the cost for my gas bill last month, and it was less than 20 cents for the certified gas. What we're seeing is the transactions are typically between a penny and 3.5 cents per million BTUs above the otherwise market price of gas. Based upon $4.80 at the Henry Hub last Thursday, that price of gas would be $4.81 or $4.83 as opposed to $4.80. So it's a few pennies. That's why it's the low-hanging fruit. There's 8 billion cubic feet a day of this low-emission gas available on the East Coast right now, and this bill would just allow some flexibility for the utilities and the commission to figure out how to get it.
I have a question, Mr. Chairman. The federal incentives, are there not currently federal incentives?
Mr. Chairman, the time should stop. If a member asks a question, the time is still going. That's not right for a member to ask a question, the clock is going.
There are incentives. The EPA has incentives. AgStar has an incentive program to work with farmers to deploy emission control devices. There are tax incentives related to the California Clean Fuel Standard. There really aren't any in Virginia. There are tax incentives for using methane from landfills to generate electricity, but not to use it in a pipe for a gas utility.
I'm talking about federally, currently, there are some federally.
For electricity generation.
Yeah.
Okay, next.
Mr. Chairman, members of the committee, David Clark, representing the Virginia Oil and Gas Association, and we are in support of Senator Servell's bill, and we applaud him for trying to solve a problem that Virginia faces with methane sources that are not originated by the natural gas companies. With your policy decisions, the natural gas companies have done a great deal to reduce the emissions from their own systems, and we're looking for this as an opportunity to help with a bigger problem. And I will just point out, we're not reinventing the wheel with this. The commission already has authority with similar programs to review and determine whether they're cost effective and in the public interest. Thank you.
Next.
Trina Jones-Robleski with Columbia Gas. Please support the bill.
Okay, thank you.
I'm Morgan Whalen with Virginia Natural Gas, and we also support the bill.
Thank you.
Mr. Chairman, Kyle Shreve on behalf of the Virginia Agribusiness Council. We support the bill. I've been asked by the Farm Bureau to register their support as well. The bill makes it easier for our producers to utilize the infrastructure and technology to sustainably capture their natural methane emissions. Our current efforts are projected to capture 2.5 million tons of methane over the next 10 years. That's the equivalent of planting 40 million new trees over that time period.
Thank you.
We support the bill.
Very quickly, Kyle, would this be revenue for some of these farms?
It is a potential source of revenue, but as you know, Senator Marsden and Mr. Chairman, infrastructure is incredibly costly for our producers to put on, and that's essentially what they're making it easier to obtain.
Thank you.
Thank you.
Clayton?
Yes, sir. Clayton Medford, Northern Virginia Chamber of Commerce, and we support the bill. Thank you.
Thank you.
Ross Nair, Prince William Chamber of Commerce, and we support the bill.
Thank you. Scott McGarry, Washington Gas. We support the bill in part because it will give us the potential to fuel bus systems such as those in many of your districts. We're in discussions right now on doing that in Prince William County and Arlington. Thank you.
Okay. Anyone in the audience?
There's some Zoom people. I think they're mostly opposed, though.
All right, well, let's take care of the people who are here first.
No, these are still people, they are.
I know they are. All right, it's, okay. They got 17 seconds, so just state your name and whether you support the bill.
Sharon Shuttler, please unmute and begin your testimony.
Yes, hi, I'm Sharon Shuttler with the Virginia Grassroots Coalition, and we oppose this bill.
Ladies and gentlemen, if you could please, on the Zoom, raise your hand if you are in favor of the bill. We will take opposition next. Thank you.
Tommy Oliver's in this. Oliver's support.
Mr. Chairman, there is no one raising their hand in favor.
Okay, so, all right. Those who are presently here in opposition to the bill, come forward.
Mr. Chairman, Walton Shepard, the NRDC. I too applaud the patron for pursuing pollution emission reductions from the methane gas sector. It's been done successfully in other states, and we can do it here. We had high hopes to work it out, but with a sensible compromise that protects ratepayers. But industry hasn't budged, and this will be expensive, which is too bad because, as the chairman is aware, we've succeeded at this before working with industry in the electric sector, where you set a pollution emissions reduction standard, target over time, and the electric utilities hit it. Not so here. The substitute before you will hit ratepayers with significant new infrastructure costs, all in the name of maybe doing something green, yet with zero accountability before the SCC for actually cleaning up pollution in a meaningful way, especially when considering the price tag will be passed on
All right,
to the ratepayers.
because you're running through everybody's time. Senator
Yes, sir.
Norman?
I'm done.
Did you hear, maybe I misunderstood what Mr. Kubler said, but it sounded like based on his calculations, that the costs were, I won't say they were de minimis,
Yep.
but they were not significant, and you just
You
talked
said
in
it was
terms of.
expensive.
I'd like to correct the record on that. That is true for
Just
the
give me
first.
the quick answer, not the
That is true
dictionary.
for the first 40 lines of the bill, but it skips the last 200 lines of the bill, which is potentially in the millions of dollars.
Thank you.
Yeah, and just to conclude, yeah, I'm done.
Chris Lane, Virginia League of Conservation Voters. Want to thank the chair and the patron for the reasons that he stated. There are major elements of this bill that we strongly support, such as the leak detection component. If it was just that, I wouldn't be standing up here. But when it comes to these projects, if I bring you a project to reduce methane emissions and to recover costs, we think it should be able to answer these questions. How much methane is there? How much methane does the project intend to capture? And then at the end of the day, how much was captured? The patron alluded that this would be determined. I would ask where that is the case. That would be very helpful. And I want to cede the rest of my time to the gentleman in the sky after stating the support or stating the opposition of the Sierra Club, Appalachian Voices, and the Virginia Conservation Network, as well as the League of Conservation Voters.
Thank you. Chris, isn't this a free market decision for people who are, potentially getting into this business as to what the costs are and whether it's worth it to them to put it into the rate structure?
So I have some thoughts on those, but I think this is a regulated decision, and I have a regulatory expert, Will Cleveland, who is in the sky ready to talk to us.
Thank you.
All right. Next.
She's the SEC. She just wanted to clarify something.
Wait.
Yes. Hi. Kim Pate with the SEC. I just wanted to make a couple comments to just clarify. Mr. Kibler had identified a 20-cent bill impact. That was just for the certified natural gas component of the bill. So the biogas facility, there really isn't an estimate for it at this point in time. I don't know if it'll be material or not. We just don't know the answer. Now, as far as the cost, there is one provision in the bill on the biogas section that is not included in any of the other rack sections for natural gas companies or for the electric racks these days, and that's a 100 basis point adder to the return on equity, which is the profit margin. And I just want to identify that that is something different than we have in other legislative pieces.
Okay. All right.
Will Cleveland.
All right, online, you got total for four of you, 1 minute and 12 seconds to just state your name and your opposition to the bill.
Thank you, Mr. Chairman. This is Will Cleveland from the Southern Environmental Law Center. I spend my entire legal practice litigating environmental issues before the State Corporation Commission regarding regulated utilities. We appreciate the patrons' efforts to address methane emissions, but as Senator Newman has already flagged, this will undoubtedly increase ratepayer costs, and there is nothing in this bill that requires any of these investments to succeed. All that it guarantees is cost recovery with a profit incentive. This is a bill for fossil fuel interests written by fossil fuel lobbyists masquerading as environmental policy. We oppose the bill.
Tommy Oliver, please unmute and begin your testimony.
Good afternoon. Just wanted to clarify, I'm actually in support of it. I'm with Roanoke Gas Company, and like I said, support the bill. Thank you.
Thank you.
Narissa Turner, please unmute, followed by Frida Cathcart.
Mr. Chair, members of the committee, I'm Narissa Turner here on behalf of the Virginia Conservation Network, and for reasons previously stated, we oppose this bill. Thank you.
Frida Cathcart, please begin your testimony.
Yes, I'm a Soil and Water Conservation District Director, and my opposition of the bill has to do with biogas, natural gas, potentially taking away the efforts of manure injection, and that improves the soil. They shouldn't be called renewable natural gas or biogas. We have better uses for that when it comes to the feces. So I want that to be taken into consideration. Thank you.
All right, the bills, you've heard everything. You want to quickly wrap up?
Yeah, Mr. Chairman, a couple of things. First of all, we added some language to the bill to try to mollify some of the objections to the environmental community. The SCC in the enactment clause is required to publish a list of every approved facility and how much methane comes out of them every year. So on the back end, we'll get some accountability of how much methane each project is generating on its own. In addition to that, well, if you feel like I need to respond to that, I will, but some of the things I said, you either trust the SCC or you don't. And they're gonna have to show the SCC that these projects are gonna generate methane and that the cost is good relative to the benefit.
Motion to report, is there a second? All right, motion and a second to report Senate Bill 565. All those in favor of reporting 565, vote aye. Those opposed, nay.
Ayes 14, noes 1.
Ayes 14, noes 1. The bill's reported.
Thank you.
All right. We have Senator Evans. This is the last bill. Senate Bill 655. Let's give your attention to Senate Bill 655.
There is a substitute.
Motion and a second to adopt the substitute to 655. All those in favor say aye. Opposed? All right. 655 is before us.
Thank you, Mr. Chairman. Now, I trimmed this bill down substantially from last week and made some changes to the substitute that are reflected in the substitute you just adopted. What we're dealing with was this, as a reminder, was the Virginia Employment Commission, and the bill does three things. It requires the employer to provide information that's given to each individual who's separated, and the information is not why you were terminated or how you were terminated. It's merely a brochure on VEC availability and information. And the information can be either handed to them when they're separated, it can be emailed or mailed to the last known address. The VEC would provide a sample document available that the employers would use. Importantly, it requires employers to submit information related to claims electronically to the VEC unless they're granted a waiver. This is consistent with the recommendations of the JLARC report. and I worked on this bill with some of the people who did the JLARC report and consulted with VEC. And the last thing it does, which is probably, this is the part of the bill that I think you all found a bit controversial last week, was providing with each separated employee with information like the date and reason of separation, that sort of thing. This would only have the VEC develop a plan to conduct a pilot program that would require a sample group of employers to proactively provide separation info, like the date and reason of separation, to separated individuals and electronically to the commission. Now, this pilot program, though, the plan to conduct the pilot would be provided to the Commission on Unemployment Compensation by January 1st, 2023. It does not require a pilot program. It just requires that one of the committees that we've appointed that oversees the VEC would have that information to study before it would come back to us, before we decided if we wanted to move forward with it. JLARC has found in the report that Virginia has historically had a high rate of confusion about the process, so the VEC would give this information like Illinois does, a brochure about what separated employees know. I know there's a notice in the break room, but as I was telling Senator Newman before the hearing, I've been laid off twice in my life from jobs because of lack of work. Once from Microsoft Corporation and once from an ad agency, my first job in college. He was asking me in my first job out of college, how did I know what to do for unemployment? And I was thinking since then, I don't know if I ever applied for unemployment for that job. The second job for Microsoft, I did apply for unemployment, and I don't recall how I knew that one, but it helps people know what they can do because, you're not going to read in the break room, apply for unemployment, and then 18 months later you get laid off and you run to the break room to find out more about it. The second thing the bill does about the electronic information, VEC already has the capability to receive electronic submissions, and this would really help streamline the process. A 2017 Department of Labor study found a significant reduction in incorrect unemployment payments when employers use this approach. Utah requires electronic submissions and has one of the lowest incorrect payment rates of all the states. So, and there is a waiver for employers who maybe don't have the technology to comply with this. This was JLARC recommendation number 22.
Mr. Chairman.
And then the third thing that the bill does, as we discussed, was the plan for a pilot program. It doesn't require the pilot, requires it to go to an organization that we've appointed to oversee VEC, and then it would have to come to us.
Okay. Senator Newman?
Mr. Chairman, first, Evan, you did take out Social Securities and you did take out the reasons. Those were really, really bad, and so I'm grateful you did. I don't think I'm quite there yet because I think the banner can help. My only question is, because I think you've made it better, which may help you in other parts of the building later on, what's the penalty for a small employer for getting to do this?
I took out the penalty. There's no penalty. They would have to, they're supposed to do it, but there's no penalty.
No
It
penalty?
was supposed to be, the $25 penalty was supposed to be removed from the substitute.
Okay, thank you.
As amended, yeah, it shouldn't be in there. And Tracy Smith from JLARC is here to answer any technical questions about how this process works or the comparison to other states, if that's helpful.
All right. Any other questions of the patron? Out in the audience here, anyone in favor of the bill? Any opposition here on the premises? Anybody in the Zoom room?
If you're in the Zoom and wish to speak in regards to the bill, please raise your hand electronically now. Mr. Chairman, there are no speakers.
Motion and a second to report Senate Bill 655. Is that a substitute?
This is a substitute we just adopted, yes.
Right, okay, as a substitute. All those in favor? Yes, this would have to go to finance. All right, the motion is to report and refer to finance. All those in favor vote aye, those opposed nay. You don't want it either.
Ayes 12, noes 3.
Thank you, Mr. Chairman.
That's small potatoes. Shit, I'm a small potato. I have to do that in a second. Very small. What, you got about 500 lawyers?
Didn't work anyway. Good.